The Welsh Ambulance Services Trust delivers services to 3.1 million people across 8,000 square miles of some of the UK's most varied terrain, from the top of Snowdon to the centre of Cardiff. As a result, data and technology is in the heart of everything we do now. We've made some huge steps forward in the digital space over the last 12 months, particularly in response to the COVID-19 pandemic. Here are just a few examples.
One of the big initiatives that we've put in place obviously over the last 6 months or so is the expansion and rollout of the 111 number across Wales.
The coronavirus symptom checker was developed in early March after confirmation from Welsh Government that coronavirus was beginning to spread in parts of Wales. With 1.3 million hits to date, it's been instrumental in managing public concerns and symptoms of coronavirus.
So we always wanted to explore chatbot technology, and during the COVID pandemic, Senseforth and FinTech Wales reached out to us and offered their services. This allowed us to accelerate that technology and get it out to market in a really rapid way. Offering the chatbot as an alternative method to access our services is really the key success, adding it to our Facebook platform, and to date we've had about 5,000 people access the chatbot.
Consultants Connect is an app-based platform that's accessible to all staff within WAST, and basically it was introduced as part of some emergency monies from Welsh Government during the COVID pandemic. So you're able to use Consultants Connect, they link you quickly to the right phone and ED, and you're then speaking to the consultant or the nurse in charge, handing over the patient's details, so when you arrive they know immediately in resus they can start that intervening or the intervention, the treatment they require.
What 3 words give us the coordinates for an area which is 3 metres by 3 metres that they can download free. The app is free. It will give us the GPS coordinate of where they are in order for us to find them quickly.
The staff themselves haven't been able to get access to the system, so I could send an email to someone trying to get in touch with them, and it could be as long as a week or 2, depending on how their shifts were and when they managed to access the system to read their email. With the iPad, they've got access. All they've got to do is switch on, connect it to Wi-Fi or use the 4G and open up their Outlook, and they'll see the emails.
I have been helping the Welsh Ambulance Service for over 2 years now. For example, I have visited lots of learning disability groups and talked about the Welsh Ambulance Service. This was the first virtual event that the Welsh Ambulance done, and I thought it was great and it could have not gone any better. We should do more virtual events in the future because lots of people can join in as they are feeling isolated, and we'll give them a chance to join in and have fun.
Through our first digital strategy, we're looking to disrupt the status quo to provide excellent services for our patients, our people and the Welsh health and care system.
Salus is a big step forward for us and is going to create a huge potential for our service going forward.
There is limitations under paper-based records and limitations in terms of where the data that's stored within them. So the benefits for staff of having an electronic patient record is portability. So using a device such as an iPad and instead of a pad of papers means that they've got that record to hand and they can adapt and edit and write on that document as they go along throughout the patient record, as opposed to it being something always done post-incident. The second big bonus is to be able to start to capture all that data and look and see how they performed. So it's interesting to see over a period of time they'll develop more and more clinical data around their performance that we can then put into a dashboard that staff will be able to review an approach to their annual appraisal and be able to see how has their activity been, how have they been performing, where's their areas for improvement and where the areas that they're doing well.
So we as a non-emergency transport service do on average in the region of 700,000 journeys a year. So the new computer-aided dispatch system is one of a few key elements of the transformation that the non-emergency service is going through at the moment. It really is important to us transforming and modernising to make sure that the transport provision for patients across Wales is improved.
We've held digital ambitions for a very long time here in Team West, and this digital strategy, recently published, our first as an organisation, will take us forward leaps and bounds in how we use technology and digitally enable you and our workforce to improve services and care for patients.